Hi, good afternoon, everybody. Thank you for joining us for the Q&A for Let Me Tell You About My Amazing Child using CYSHCN data. I am Janina Ong from AMCHP. This is my son. Sorry, work from home thing. He is actually a child with disabilities, so I'm very proud to be facilitating this session. I will be asking our presenter here, Karen, the questions that you have submitted in the platform. If you did not get to ask your question in the platform, feel free to put it in the chat and we'll make sure that it is addressed. Karen, if you wouldn't mind just introducing yourself really fast. I know that they watched the video, but you can go ahead and say hello.
Well, thank you, everyone. Thank you for attending this session. I'm Karen Dash. I'm a consultant. I'm working with the Innovative Approaches Initiative and other initiatives here in North Carolina and throughout the country.
Thank you, Karen. So I'm going to start with some questions that we had in the platform. Veronica asked, I have looked at the NSCH, but the sample size per measure seems to be low. How does this impact the overall data and picture of the CYSHCN population?
Thank you, Veronica, for that question. It's a great question. It's a great issue. I know that for some reports that I've presented, for some of the measures, I've had to say the sample size is small and that this kind of needs to be taken. I think of it in terms of a directional nature. It is an issue that some of the questions, some of the answers have small sample sizes for particular states, sometimes in particular years, just depends on the circumstances. Oh, thank you, children and youth with special health care needs. But I think, it's the best data set we have, the amount of resources that go into it, the comprehensive nature of the questions, and the data that we do get is as good as we can find, at least as good as I've ever found out there. I do include that caveat, though, that sometimes the data, it's not a sufficient sample size to be statistically as valid as we would like, but I do feel that there's value in terms of being directionally helpful, giving us a sense of the scope, potential scope of a particular issue within a state. I hope that's helpful, and I'm happy to answer any follow-ups you have regarding that.
Thank you, Karen. We have some other questions as well. Vinita asked, what role should incentives play in recruitment and compensation for data collection? Do you have any advice for qualitative data collection and how to use incentives?
Yes, thank you. That's a wonderful question. It's funny you asked that. At 5:30 today, I have a focus group for a project I'm doing on school-based mental health care. And we are offering incentives for this focus group. I think that they can be very helpful. It's something that, clients struggle with sometimes with the initiatives that they are trying to gather input from. They might not have a budget for that. This particular initiative does. I think it's helpful to offer families, we kind of think of it as paying them for their time and their expertise. Just like all of us get paid for our expertise in one way or another, working with families and asking them for their feedback can be very helpful. This group that we are meeting with, what we did is we asked at the various schools what gift card, for example, they thought would be most helpful. So some are using Sheetz gas station cards, some are using Walmart cards, some are using the local restaurant cards. Another thing that we found that can help incentivize families is to offer food. I had a client, Miss April, I think I mentioned her in the presentation, and she would just have these incredible meals, great Southern food, country Southern food, and people enjoyed coming for that. Sometimes you can incentivize families by offering, if it's possible, daycare for their children. As well, so that the child can come with the parents and then have some fun socializing with other children. That's another way that you might be able to incentivize folks. I do think there's a place for it, though. Again, thinking that we are offering families compensation for their time and for their expertise. And again, I'm happy to answer any follow-ups you might have.
I think Benita also had a question about resources for guidance surrounding qualitative data analysis.
Oh, yes, yes, I remember seeing that. Yeah, and Vinita, if I may, if it's all right, I would be happy to follow up with an email with some links to resources. The reason I say that is because when I started in this field, I've been a consultant now for 11 years. And when I started, I utilized various resources, different qualitative analysis textbooks and things like that. But I found over time that it's become much more self-taught because, as I hope I expressed during the presentation, things have changed in terms of how we communicate with families, multiple competing demands on families' time, the issues that we're looking into, the way we're asking about those, and so. And so my techniques, have changed, but I'm very happy to recommend some resources. I just kind of need to go back and look at what I was using and what I think is good today. I know there's some great things out there. Different government agencies might have some good resources. I was just thinking of one before when I saw your question come up related to health, and I apologize, I can't think of it now, but I'm happy to send those to you if that would be an acceptable arrangement, and anyone else who would like that information.
Perfect. I have collected her contact information and I will put you two in touch. Feel free to continue to add questions to this chat so that we can ask them. I have a question from Cheryl. For NC, can you stratify by race the CYSHCN population? If not, how do you address this?
Thank you. That's a great question. Sometimes it feels like a bit of a holy grail, being able to have enough data to be able to stratify by race, by ethnicity, by language, and so on. We've had, as I think I mentioned, I've worked with, I think, about 18 different counties, and we've had, I think that the highest number of responses we had was around 160 or so. And then others we had maybe 5 families or 8 families responded. And so stratifying didn't make sense in the latter case. Most of our data sets the number of participants that we get is maybe between 10 and 20. Maybe we've had some surveys with 50 to 60, but it's hard. It's hard to get a large enough sample to be able to stratify. We do offer now surveys in English and in Spanish so that families with prefer Spanish language, surveys can complete them that way. And we just, do the translating of those. So we try to gather as much data and be as inclusive as we can. Unfortunately, most of the time we don't have enough data to be able to stratify in a way that is meaningful for talking about results for families who are Black versus families who are white versus Asian and so on. Thank you for your question, and I'm happy to follow up if you have any follow-ups to that.
I would love to know, it's my own follow-up. I would love to know if you do focus groups in translation and what that looks like if you're the one who is looking at that data.
Yeah, thank you for that. As I mentioned, I'm doing this project now with school-based mental health care, and I think it's next week. We are going to do a focus group that will include English-speaking and Spanish-speaking families. And so the school, I don't speak Spanish well enough. My husband does, but he doesn't know these issues, so he can't be helpful. But that particular school is going to have a member of their staff who is a Spanish-speaking person who's going to translate for that group of families. But it can absolutely be done as well. We could do that. When I was speaking with this particular county about this focus group, we had offered that I have colleagues who are Spanish speaking who might be able to help out, particularly since it's also an online focus group. But in this case, we're working with that school member. I hope that's helpful.
Yes, it is. Thank you. We have another question from Vanita. Have you used billing data for assessment of adequacy of CYSHCN healthcare utilization? And or do you think that this is a reasonable plan?
That's interesting, using billing data. I have not done that. I think that's a great idea. I guess if you could share a little more about how you would utilize it. Do you mean in terms of the services that are utilized or how it is paid for? What were you thinking about in terms of utilizing that data? Yes, and to see if they meet the recommendations. Yeah, that's a great idea. Yeah, that might be something to look into. I can see, one of the drawbacks or challenges to doing so would be privacy considerations and having access to that type of data. If a particular provider was willing to share it, or an insurance company was willing to offer de-identified data, that could be very helpful. I guess the challenges might be comparing that data to a particular child's diagnosis and condition, and then being able to understand what recommendations were made by the doctor. It's a really cool idea, but I haven't considered that. I appreciate your bringing that up.
And just for people on the recording, I'm going to read what Benita says. We are planning to link out birth defects surveillance data for kids with Down syndrome to billing data. Some
Very
other
cool.
questions that we have from Sandy. Sandy says, we live in a very diverse state and often have small multi-race or other category. We struggle with how to interpret those results. Any suggestions?
Yeah, it's challenging, for the reasons we've talked about, small sample size and being able to say something statistically meaningful. I think it's still representative, and I keep saying directional, but I think that it just gives you a general overall flavor, if you will, for the prevalence of particular conditions or concerns or attitudes within a particular population. But it is hard. I appreciate that you all are trying to do that, and like I said, I wish we could do that as well. It's really important data, because we know that the experiences of different ethnic and racial groups can vary quite a bit. Geographical groups can differ quite a bit. I'm working on a project now, a rural healthcare study, looking at rural counties in North Carolina versus urban and suburban counties, and their experiences are so different in interacting with the healthcare system. So I appreciate the need to do that kind of segmentation. I still think that presenting it as I have done, with the understanding that this sample size is small, but we still feel that it is worthwhile, to include this data. It could contrast, even a small sample size could contrast with what another racial or ethnic group is experiencing, and that's important to tease out those differences.
I guess I'm wondering, Karen, like, how do you allow people to mark for multiracialness? Or is it that you ask them to mark for one? And if then they mark for more than one race, like, how would you analyze that?
We do, and let me preface this also by saying that not all of my clients ask for that data. That's just their preference sometimes. They feel like, we want to respect families' time. We really need to understand questions about their child's condition. We don't want to ask them too many personal questions. And so sometimes we don't do it. But what I always do when that question is presented, no matter what my project is, I use the census categories, and I invite people to choose as many as they would like, whatever reflects their personal experience. And then the data is reported. It's reported, if there's enough data, as two or more races. Sometimes I'm thinking of different projects. Sometimes we've included, for example, if a person says that they are white, Caucasian, and Black, we might include it in both of those categories as well, but with the caveat that this person has identified as multiracial. I hope that's helpful.
That is so interesting. I think everybody's trying to look to solutions for that problem. So it's always great to hear, what people are trying. We have a question from Diane. She's asking if have you gathered data from undocumented people? We have struggled to offer gift cards through our institution to families without documentation. And I wonder if there are any creative solutions.
That's a great question. I can tell you that I keep mentioning this project because that's my incentives and gift cards that I'm working on right now. But I know that what we are doing for those families, and I don't know their documentation status. I know that one county in particular, I know they have a large undocumented population, and the school really wants to reach out to those families. So what we've been doing is, if the school says that, this person A, B, and C will be attending and we'd like to get them a gift card, we're offering them different ways to do that. So for example, we could email them, and my colleague is taking care of this, but I've listened enough to know that she's offered to email it to that person's email address, or to have that person sign, when they go into the school and receive a hard copy of the gift card. So we aren't paying attention, if you will, to documentation status or making any distinctions in how we provide those gift cards. I appreciate that some jurisdictions may have, have those distinctions that need to be made. In that case, and I don't know what the ethics are of this or the legalities of it, but if it's something where you could reach out to families via email or some other, unofficial channel, perhaps. But I'm not sure how I would go about that.
Karen, I think I've had this problem where in order to expense the gift cards as like a business expense, you have to, send people the tax forms for it as well, because gift cards are now taxable like gifts. So I think that that's part of the issue as well.
That's a good point. And maybe I'll step back, because you raise a good point. For my initiative, it is a state-funded initiative, but for bureaucratic reasons, it is going through a nonprofit. And so I think that nonprofit has different rules than the state or a governmental entity might have. I appreciate that. That is an issue that we haven't asked about in our initiative. And so I'm not sure, to be honest, how we would handle that other than what I've suggested.
Yeah. Thank you, Karen, for suggesting those things. I'm wondering if anybody else in the room has questions. You can feel free to unmute yourself and just ask Karen your question, or put it in the chat if you're not able to unmute yourself at this point.
Hi, Karen, this is Cheryl. I'm supposed to be helping Janina out, but I have to ask this question. Kind of follow up to the stratification by race. Do you recommend that folks try to get HRSA or pay for HRSA to oversample? If you have small,
could you repeat that?
Oversample by race?
Oh, oversample
for the National Children's Survey, yeah.
Oh, if I may rephrase or repeat your question, you were asking if because of issues of population size, if it makes sense to oversample for different racial or ethnic groups within the national survey?
Right. I'm wondering, do you encourage people to do that, because so many things are tied to race and ethnicity, and there's such a focus on it? I'm just wondering what you recommend folks to do.
Yeah, we've had different situations in different counties. One county that I've worked in has I think about 42% of their population is Native American or American Indian. And so we want to make sure that we are at least getting a representative sample of, that population. And in terms of over sampling, we try to do that. It depends on the community. I think as a general strategy, I think that is a good strategy, because I think that we see that those outcomes are different, and we don't know how many responses we'll get and so on. But I think that based on the different communities I've worked with, some of them are more interested in looking into that issue than others. I mean, I guess I'm not answering the question by saying, well, it's up to them, but I think that my feeling is that overall, it is definitely a strong strategy to oversample for racial and ethnic groups that are not in the majority population of a particular county. Does that answer your question, Cheryl?
Yes, and I have respect for you saying that it's really up to them to, to decide that. So thank you.
Oh, sure.
We have more comments about gift cards. Veronica said that families might not trust the system of getting a gift card in return for personal information. I guess I'm wondering, what do you promise these families that they will be getting in return for, sharing their time? And I know I've run focus groups in the past, sometimes really traumatic experiences that they share.
Yeah, and we don't do it all the time. I would say I have to think of how many focus groups I've run, say 70 in the last 8 years or something. I would say we've probably used actual gift cards, maybe in 10% of them, 7 or 8 of them. This particular initiative I'm on now, that's just a feature of the particular, that's part of the philosophy of the program, is let's pay families for their time. I think that it's really important, as I kind of mentioned a little bit in the presentation, I think it's really important for families to understand why we are asking them to share their information and their experiences. I think it's really important for families to feel that they have a warm, safe space to talk in, and that they aren't going to be judged and things aren't going to leave that space. And maybe I should have spent more time talking about that, but just creating a place where people feel comfortable and feel that they can trust in the integrity of what's happening and in what will be done with the information that they choose to share. I hope that's answers that question.
Yeah, I appreciate that. We have another question. What project have you participated in that you are most proud of in terms of the impact on data utilization for program planning or evaluation purposes?
Oh, that's such a lovely question. Thank you for asking that. There are many. I think that if I had to choose one, it would probably be in this county, Robeson County. That was the Photo Voice project that I worked on, because it was fulfilling in many ways. It gave power and voice to young people and their families. It allowed them the control. They controlled our agenda. They chose our themes. We worked together. They chose representative pictures. We had a night that feted them and their work, and we brought the community in. We had probably close to 50 people, including government officials who came. I brought my young son at the time. He came down. It was like an hour and a half drive, and we went there, and it was a culmination of a lot of work. We gather feedback from families and young people all the time, but I think that them being able to be there when we shared our results and kind of being center stage and able to answer questions and talk about their experiences, I think that was probably my most fulfilling project. But thank you. It's a great question. I love my work because I do so many great things with so many great people.
I love that. I love hearing about photo voice projects, and I think that they're really impactful. I'm wondering, how, have you seen qualitative data transform into policy recommendations or changes? Because I think that that's sometimes a struggle. You collect all these, very important pieces of data, but then people don't want to, transform it into action.
Yes, I appreciate that. That's absolutely true. We gather this data and it's so important to us. And then, we take it and bring it to public officials or decision makers or heads of agencies, and they've got a million things to think about. And so it's hard sometimes to translate it. I think some of the things that we've seen, I'm going to mention Robeson County again and Miss April. It's too bad she's not here, but she had a couple of initiatives, but one that I'll talk about. One challenge, I think, for families and young people is, for example, summer programming. It's not inclusive enough for all children of all abilities and all backgrounds. And so one thing that we worked on was making public officials aware of how important it was to plan for and present programming that included lots of different children. And so that the way Miss April told the story is she would go to these meetings, like say I'm just making it up, in 2015. And they would be setting up their summer schedule, and she'd say, well, what are you doing to be inclusive? And so then they'd have to work on that. And so 2016, she'd do the same thing. And she said by, 2017, 2018, when she would walk in the door, they'd be like, okay, let's talk about inclusive programming. By 2019, they knew to include all children of all abilities. So it was kind of a practice change, perhaps an official policy change. So that was one example of seeing, things occur over time. It was a culture change, I suppose, as well.
I love that. I mean, I am part of parent groups as well. And I think sometimes we just take it on ourselves to create programming for our kids when, in reality, they really should be included in a lot of programming. So I love that story. I want to put out a last call for questions. Anybody in the Zoom room, if you have a question, feel free to unmute. But otherwise, I feel like we've learned a lot from Karen.
Well, thank you so much for your time. And if you have any follow-up questions, please feel free to reach out to me. I'm very happy to help out in any way I can.
I am not seeing any questions. So thank you so much for joining us today. We hope to see you at other sessions. Thank you so much to Karen for answering all the questions and for her great presentation. It was so lovely to meet you and to hear your thoughts on this topic.
Thank you, everyone.